Dr. TJ Panek is with us talking about total knee replacement. Who is the perfect candidate for a total knee?
Well, it's really somebody who's exhausted all the conservative treatment options for their knee. It's somebody who's having a lot of pain and they're having a lot of difficulty both in their daytime life and sleeping sometimes is also another thing that drives somebody that way. Hopefully they're healthy and pretty active and able to get through a major elective surgery.
What causes the pain?
Well, usually it's osteoarthritis is the most common problem, but it's some form of arthritis, a wear and tear of the cartilage.
Okay, and talk about the surgery.
The surgery is it's a great operation. We are able to do a less invasive approach to the knee than what we used to do, and we basically go in there and resurface the knee. A lot of times people have a misconception that the word total knee replacement means that we're going to cut their femur above and cut their tibia below and put a large hinge in. That's not at all what we do. We make a limited exposure to the knee, shave that damaged surface cartilage away, and then we go ahead and put on new metal and plastic surfaces.
And afterwards?
Patients do great. They're really very happy. They have to work hard to get through the therapy process, but in the end, they really have a far better quality of life, less pain and better functionality.
After the surgery, you try to get them up right away, right?
Right after the surgery, that evening, we try to get them up and actually take a few steps on their new knee, start working with the therapy and the range of motion right away so that they're not slow in their recovery.
What's the most gratifying thing for you as a surgeon with a total knee surgery?
Well, by far, it's seeing that patient after they've gotten through the hard part, the recovery and the rehab. Seeing people who were really, frankly, close to disabled, being able to get up and walk around and do their activities of daily life and not have that pain anymore.
What takes them so long to decide, let's just do this total knee?
Well, it's a combination of us telling them they should wait as long as they possibly can, and some fear about what the unknown of having that surgery is and what it might entail to get to the end point.
Yeah, and talk about therapy.
Well, physical therapy is a really important part of the outcome. It's important to find a good surgeon who does a good job, but I always tell my patients, I'm going to do my part, but that physical therapy part is equally important to them having a good outcome.
Yeah, thank you.
You're welcome.